To turn things back over to Dr. Schwartz for this is the second or the third time.
Yes,
Okay.
okay.
Talk about the next
So
phase.
why don't I keep Mary up here for a few minutes? I'm not so concerned about this evening since I have you all captive here. Lee was concerned, but I'm not concerned. So I'd like to open this up for a couple questions while we have Mary here with us as the scientific director. Are there questions that relate either to the discovery process or questions about the approaches that it takes to unravel ideas in biomedical science? Please don't feel shy. We'll take it back there first.
I'd have a question as to, do you have any delineation between congenital heart defects or congenital defects in general and congenital disease?
Yeah, that's a very good question. There's often an overlap, and very often we see children with congenital heart disease actually have problems elsewhere, other developmental problems. So sometimes the most serious or dramatic manifestation in the heart is in the heart, but then some of these children have problems with limb anomalies or skeletal problems, and that's because you're affecting some fundamental developmental processes that can affect the development of multiple organs.
So you're working on both of those, but you separate them in.
Well, it's from different angles, because sometimes you'll learn something. This is a great example. You could learn something where the most dramatic manifestation maybe is in a bone, but then you'll say, oh man, the same pathway is affected as a cause of the disease in the heart. So that's where you get that crosstalk going.
Thank you.
Mary, if you took the process that you described as part of your presentation and said, in today's environment, the CDI, that was 70 years from the time it was identified until the time the cure was actually developed. If this were identified tomorrow afternoon in the CDI with today's technology, collaboration, everything else out there,
How long would that take?
hypothetically, what would that
Oh, that's a hard question. It would still take a long time. I would say it would still take at least 20 years from making the first thing that says the cause of the disease. Even though we're a lot smarter, well, I wouldn't say we're smarter, but we have more technological tools.
Well,
But it would still take a long time to figure it out.
So it's okay to say.
When you are ready to go to patients with the modality of treatment,
Mhm.
who do you have to go to get permission? Do you have to go to government, or is there any way around that? Or?
Well, there's a whole process for doing even in a study where you're just trying to, for example, look at blood samples to see whether this test might correlate with something. But you would there's a whole series of protocols that you write that are very carefully reviewed by the Institutional Review Board. You have a lot of justification. You need a lot of preliminary data, both in some cases animal studies and in early studies and sort of pilot studies, and it's a whole stepwise process. So that takes a long time, just even to test the idea. First you do it in a small group of patients and a larger group of patients. That in itself can take many, many years. Other questions?
I believe it was in August of 1962, and the little newborn infant of President Kennedy, his mother, Mrs. Jacqueline Kennedy, was hospitalized, I believe, at Otis Air Force Base Hospital, where she gave birth. And I believe the baby was a number of weeks premature. And I've been blessed by the good Lord with an excellent memory. I believe the cause of the baby's expiration was ascribed to hyaline membrane disease, because the lungs, unfortunately, had not had a chance to fully develop. And
You're exactly right.
Am I correct?
You are exactly right.
And I can't help but speculate, President Kennedy's father, Ambassador Joseph P. Kennedy, was a very well-known philanthropist, and perhaps the whole field might have been advanced by a number of decades had he been apprised of the reason for the death of his grandson and stepped up to the plate with a big wallet and advance your field by decades, you know.
Mhm.
But I thought the hyaline membrane.
Yeah, that is exactly right. It's really because you don't have that surfactant material to keep the air sacs open, that it just all collapses.
And I think the infant named Patrick Bouvier Kennedy only lived about a day or two.
Yeah, I think he was maybe 2 months premature, and then,
Yeah.
now would have been, so treatable, so, yeah.
So that actually is our goal. Our
I'm sorry?
goal, that is our goal, which is to identify significant problems of pediatric disease and be at the forefront of being able to diagnose them earlier, treat them more effectively, and ultimately prevent many of them.
So please join me in thanking Dr. Ditto.